shoes and out the door. 5, I'm alive. 6, 7, 8, feeling great.
Hello and welcome back to Beyond Your Wildest Genes podcast. My name is Dr. Noah DeCoyer and I am your co-host. Today our guest is Dr. Alvin Danenberg. Dr. Danenberg divides his career into 2 periods, before and after the laser, coupled with the dynamics of ancestral nutrition. The laser-based LANAP protocol and the importance of ancestral nutrition he believes are revolutionizing his treatment of gum disease. LANAP is an acronym for Laser-Assisted New Attachment Protocol and requires no scalpels or sutures. Dr. Danenberg received his dental degree from the Baltimore College of Dental Surgery in 1972 and his specialty certificate in periodontics from the University of Maryland School of Graduate Dentistry in 1974. Currently, he practices periodontics from offices in Bluffton and Beaufort, located in South Carolina. Dr. Danenberg received advanced training in ancestral nutrition from the Kripalu Center for Yoga and Health, as well as the Center for Mind-Body Medicine in 2013. In 2014, he received a CFMP, Certified Functional Medicine Practitioner, designation from Functional Medicine University. In September 2014, he received the designation of Certified Primal Blueprint Expert. Also in September 2014, Dr. Danenberg completed a clinical study that he designed and implemented evaluating nutrient-dense real food supplements and their effects on gum disease, which was published in the March and April 2015 issue of Well-Being Journal. In July 2015, Dr. Danenberg created the Integrative Periodontal module for the College of Integrative Medicine's 300-hour certification program titled Certified Integrative Health Practitioner Program, which commenced October 2015. Wow, that was a mouthful. Doc, how did a guy like you start on this journey?
Well, first of all, you got to understand I'm an old guy. So this coming April, I'll be 69 years old. So it's a long time coming. But, I thought, I went to dental school. I did all my training. You would think that a professional healthcare type of person would know everything they needed to know to be healthy. And I thought I did. I did all kinds of stuff. I was exercising aerobically, maybe an hour a day, 4 or 5 days a week. I thought I ate healthy foods. I ate low-fat, high-carb, high-fiber food. I thought the things that everybody was listening to on the radio and TV were accurate. So in 2006, something happened to me and I almost died. I had a stroke. And here I am thinking I'm very healthy. So the whole process of having a stroke for me, of course, was unbelievable. My daughter and her family were staying at my house as they were transitioning to Portland, Oregon, and I live in Charleston, South Carolina. So I'm standing in my living room and I'm holding my computer, and all of a sudden I get a shock going through the computer, through my hands and my arms. And I drop my computer, and my daughter, who's sitting on the floor, looks up at me and said, "What's wrong?" And I say, "I just got a shock from my computer." And she said, "Don't be so melodramatic, Dad." And then 1 week later, I had a stroke. So what happened was I was sleeping with my grandson in the bed. He was maybe 5 years, 6 years old at the time. And it was a Saturday morning, and generally Saturday mornings I would go to him, and they lived maybe a couple blocks away from us. I would go to their house and take him out to breakfast. So I turned over and I tried to say, "Jake, let's get up and we'll go to breakfast." And I couldn't speak. It came out like, none, huh? And I thought, maybe I'm dreaming. Maybe I've been sleeping with my mouth open. My mouth is dry. So I got, no problem, went into the bathroom, got a drink, came back into the bedroom, and I couldn't speak. Now, my wife is still sleeping. I woke her up. She is a registered nurse. She knew exactly what was happening. And she took me to the hospital. I'm having a stroke. Amazing. So it took maybe 2 months or so for me to fully recover and get back to practice. And that was pretty quick, I think. I realized I needed to get educated about something that's going on in my body. And my doctors, of course, saved my life. And they put me on 6 or 7 medications. And they said, I'm going to have to do this for the rest of my life. And they never told me what else to do or what even caused the stroke. So in 2013, we're going to jump forward 7 years. 2013, I heard of a course at the Kripalu Center for Yoga and Health at that time, and it was called Nutrition Intensive for Healthcare Professionals. It was a 5-day course, and I thought this was going to really hone in all this new information I learned for the last 7 years from my stroke up until then, and it would just give me some more pearls to learn. So I took the course. It was fascinating. And the first day of the course, I learned that basically everything I was doing wrong. The course was based on evolutionary medicine. It was phenomenal. And from that point on, 2013 until today, I've changed my life. And I went home at the end of the course, and I told my wife we were going to make some changes, if that's okay with her. And she and I bumped heads a little bit. We cleared out all the processed foods that were in our pantry and freezer. We had 7 bags of foods that we took to the food bank. And from that point on, like I said, I changed my life and diet. I basically become paleo. I eat plenty of vegetables and lots of grass-fed beef and wild-caught fish and green smoothies every day and exercise in an efficient way and sleep well and whatever. I have changed my entire chemistry pattern. I have changed my weight. I've lost over 30 pounds. And I'm not trying to do any of these things. I'm just eating healthy and everything follows. So that's how I got where I am today. And of course, the interesting thing is that gum disease, for the first 2.5 million years of the evolution of our species, was not existent. Hardly ever did the skeletal remains of our primal ancestors show any gum disease of the bone or dental decay. But something happened around 10,000 years ago that started to change these skeletal remains, and it's basically our diet and lifestyle.
Dr. Danenberg, let's take us one step back and then jump right back to where we left off. Tell our audience or explain to them in your terms, in your words, what is evolutionary or ancestral nutrition?
Sure. Okay. Our primal ancestors, our species, evolved over 2.5 million years, so to speak, or give or take. And during that period of time, our species ate the foods the environment provided. Now, if they were living in the northern areas that were very, very cold, they ate the foods that were there at that time. If they were living around the equator, they ate totally different foods. It's not that what they ate was so specific. It's that what they didn't eat was that specific. So our ancestors ate the foods the environment had provided. They were physically active. Their bodies were healthy. They basically were not contaminated with toxic substances from chemicals. They didn't have fluoride that was introduced to their waterfall system. So, they ate and lived the way nature provided them. And that's basically, that basically allowed their bodies and their brains to evolve to being a pretty perfect species up until about 10,000 years ago. Does that help?
Yes, of course. So now tell us what happened 10,000 years ago.
So there has been from signs in skeletal remains and other archaeological digs have shown that various things started to develop. Agriculture farming began around 10,000 years ago. And man learned how to grow grasses and also learn how to take the seeds of these grasses and do things that processed the seeds and made them into flour and a variety of other processed foods, basically the grains. And these grains were damaged to the point where the cellular lining of these the grain cells were destroyed, and the carbohydrates were compacted, and they were called acellular carbohydrates. They did that also with sugar products. Sugar in vegetables and plants, they could condense them and destroy the cell lining and condense these sugars. So they processed the grains, they processed the sugars. Our body has never evolved to digest these concentrated acellular carbohydrates. And these acellular carbohydrates went on to change our digestive system in such a way that affected the homeostasis, the balance of our gut bacteria. We have, as you know, 10 trillion cells of bacteria in our body, or 100 trillion cells of bacteria in our body. We only have 10 trillion human cells. And these 100 trillion bacterial or microbial cells have a purpose in our health. Our microbiome is effectively creating a healthy environment for us, and if it is disturbed, a variety of chronic diseases develop. And this homeostasis was actually compromised because of the foods that were being processed and given to the masses, and these are the acellular carbohydrates primarily. Once the changes in the bacteria of the gut occurred, it changed the bacteria in the mouth. And it created more virulent types of bacteria along with the acellular carbohydrates, which were fermentable. These bacteria started to ferment these carbohydrates, creating a variety of unhealthy types that caused tooth decay and gum disease that never existed before these acellular carbohydrates were predominant in our diet. Now, that's not the only bad food that started to be processed, because as time went on, as you know, chemicals were added to foods and these toxic substances started to accumulate in our body, and a variety of unhealthy oils were being processed. That also stimulated a variety of unhealthy reactions to our body. So basically our diet started to change 10,000 years ago for the worse. And our society is a recipient of this very unhealthy diet as well as lifestyle change.
Now, you've been a periodontist for how many years? 40 years?
Yeah, 41 years. 40. Long time.
Right.
Coming up on 42 years, yeah.
So, in your estimation, has gum disease gotten worse over those 40 years?
Without a doubt, from what I can see. I never understood the study of how many people have gum disease as I was going through my profession. We didn't even learn that in dental school. We had some percentage numbers, but I didn't even see real good studies. But there are current studies right now, today, that demonstrate or suggest that there are approximately 96% of the U.S. population involved with gingivitis, which is the earliest stages of gum disease, just inflammation or bleeding of the gum tissues, not deep damage in the bone, just bleeding gums. 96% of the U.S. adult population has gum disease. And a more recent study, this study I think was done in 2009, but in 2012 there was a published study that showed 47% of the U.S. adult population has periodontitis, which is the advanced stage of gum disease destroying the jawbone and progressing to tooth loss and pain and swelling and of course, the spread of infection throughout the body.
Right. Now, how did you treat gum disease, 30, 40 years ago, as opposed to how you treat gum disease now?
So for the first 35 or 36 years of my career, I was trained traditionally, and I treated periodontal disease traditionally. Of course, we treated gum disease just like an infection finger if you had a splinter. So the most important thing if you have a splinter in your finger is to take care of the acute problem. You can take all the antibiotics in the world, all the herbal medications in the world. You can sleep 8 hours a night. You can do all kinds of exercise. And you know what? Skin where the splinter is stuck is still going to be infected. Now, if you remove the splinter, everything heals. at least the body has the potential to heal because the irritant is removed. So in gum disease, treating gum disease or any dental infection, you need to remove the acute cause of the infection first, or treat the acute signs and symptoms of the infection so that the pain and the swelling goes away. So that's what we would do, a deep type of cleaning or something like that to remove the splinter, so to speak, from the skin of the finger, like the calculus or tartar that's under the gum. And if necessary, use antibiotics. Now, from that point on, if there was severe damage in the bone, the treatment of choice as a periodontist would be to take a scalpel, cut the gum tissue open like you would open a banana peel around a banana, and treat the bone in a variety of ways and put bone graft material in and other chemicals that supposedly help the bone to restore itself. Clean everything out, close the gum that you opened up and use little stitches that held the gum together around the tooth and the bone. And then the patient would have to deal with that. And patients would suffer for several weeks. There was swelling and bleeding and sensitivity. And of course, my patients didn't love me at that moment. And this is the traditional way of treating gum disease today. So I would say at least 75% of periodontists today are still treating gum disease that way. I have changed my methods. So about 5 years ago, I found out of a procedure using a very specific laser. Now, there are a lot of lasers in medicine and dentistry, and all the lasers do all kinds of different things based on the wavelength of that light. It's amazing that light can do all of these things, but that's the case. So we have a very specific laser called the periolase laser and a protocol called LANAP, which is Laser-Assisted New Attachment Procedure. In this procedure, we have to numb the gum tissue, but we do not have to cut the gum with a scalpel. We don't have to use stitches, and the patients the next day go about their normal routine. I'm like a saint all of a sudden, right? So patients are now not experiencing the swelling and the pain and the bleeding and all the discomfort that is associated with traditional periodontal surgery. So what's very interesting about this laser light is we numb the gum tissue, like I said, and we go between the gum and the tooth with this little fiber optic. It's like the thickness of 3 human hairs, pretty thin. And it's firm, though, and we can place it between the gum and the tooth, and the light flashes about 20 times a second. And that light, the specific wavelength of that light, kills the most pathogenic bacteria that's causing the gum disease, called P. gingivalis. It literally is absorbed by this pathogen, and the pathogen, the bacteria, explode. But the light, the laser light, does not harm the healthy gum tissue or the bone. As a matter of fact, the protocol, the LANAP protocol, actually stimulates new bone cells to come into the damaged area of the bone, almost like stem cells. And we not only are killing the bacteria, but we are getting new bone to grow. And because of the laser light doing what it's doing, it creates a sticky substance around the existing blood cells, and the gum seals to the root of the tooth with a sticky clot, and the healing takes place in 4 to 6 weeks, but the bone takes maybe a year to a year and a half to grow. But the next day, patients can go about their normal routine. And that's the way I treat gum disease today. And we were getting phenomenal results.
And I would assume that with your new patients, you're teaching them this ancestral nutrition to help prevent any further degradation of their gum tissue?
Exactly. So my philosophy of treatment would be the first thing we need to do is to take care of the acute problem. So the patient walks in, they have lots of bleeding gums or swollen tissue or whatever, they're in pain, they just feel miserable. We need to arrest that component that is creating the acute infection, just like taking a splinter out of your finger. And then the rest of periodontal disease is a chronic infection, and it's a result of just not the bacteria around the teeth. It's a result of what caused the bacteria to become virulent around the teeth, and that's not just plaque. It's the foods that we're eating and our lifestyle that's changing the bacteria in our gut, that is changing the bacteria in our mouths. And there's a great study that really brought that home. If you want, I can just give you a quick discussion about that study.
Sure, absolutely.
So in 2012, Dr. Baumgartner did a study that was published in the Journal of Periodontology. I think it was 2009. And he observed 10 individuals in Switzerland. And these 10 individuals, they had to live for 30 days with only eating healthy, unprocessed foods, the basic foods that they had to hunt and gather. They could not eat anything that was processed. They also could not brush or floss their teeth for 30 days. Before the study was done, in that particular environment, their mouths were examined. Their bleeding points around the gum tissues of the teeth were evaluated and identified. And the bacteria around the gum, the plaque, was cultured. 30 days later, they couldn't brush or floss, but they could only eat healthy, raw, unprocessed foods that they could find in the environment where they were living. They had tremendous amounts of bacteria, but the cultures revealed that there were no virulent bacteria anymore. The bleeding of the gum tissue actually decreased, and the pocket depths actually decreased. That's amazing. 30 days, no brushing and flossing, lots of plaque, but almost no gum disease. What's up with that? And it's because the bacteria in the gut became more homeostatic, more balanced, and it changed the bacteria in the mouth in just 30 days. That's an amazing statement.
It shows you how powerful nutrition can be in such a short period of time.
Without a doubt. And the interesting thing, and that's a very important statement, because people that are sick can really make changes in their body very quickly. Now, it takes a while. I'm a work in progress. A friend of mine who is a conventional physician as well as a functional medicine physician told me that it takes about 1 month of eating and living a healthy lifestyle to repair 1 year of damage. So if I realized that I was maybe an unhealthy guy for 66 years before I got on the right track, it's going to take 5 or 6 years for me to get healthy. And I'm in the 3rd year right now. So I'm a work in progress. I feel healthier today than I have ever felt in my life. And I think my chemistries are healthier, my exercise level is significantly healthier, and you can see, like you said, you can see a change very rapidly, and then there are other chronic changes that will occur as time goes by. So let me get back to the way I treat gum disease. So I treat the acute infection first, and then I remove what is really causing this disease, not the acute phase, but maybe the bacteria that's causing some of the damage, and that's where the LANAP procedure comes in, or a deep type of cleaning procedure comes in. And we want our patients to understand that the way they got to the state that they are in is not just because they weren't brushing or flossing. It's because of their lifestyle and diet. So I go through a 3-day food journal with my patients if they're interested. I go through lifestyle changes, and we go into a tremendous amount of discussion on how to change their diet and lifestyle to support their immune system, so going forward, they hardly ever will see these gum disease problems. And by the way, their chronic disease will start to get better too.
That's beautiful. That's beautiful, beautiful. Now, you have another exciting bit of information that I'd like to discuss. You're in the final stages of releasing a book. Tell us about it.
Yes. Well, I have been writing a book called, it's been a variety of names, but the title today is Hunger for Health. And right now, there are 2 publishers that I've been told from my literary agent who are interested in publishing this book. So it's not really a contracted thing yet, but I'm hoping to have that happen in the very near future. And it's a book that is somewhat paleo concept, but it comes from a different perspective. It's rather unique. We're talking about the unique human condition with an evolutionary perspective by me as a periodontist. So, everything that goes into our body, or almost everything that goes into our body, goes through our mouth first. And that's how I start the whole concept. I'm talking about how our bodies evolved for 2.5 million years and what we're doing today to really damage our bodies by the foods that we're putting in our mouth as well as our lifestyle. And almost everything that happens in our body from a manifestation of disease shows somewhat in our mouths. So damage to the mucosal tissues and hard tissues of our mouths change when we have other chronic infections and damage to our body. So the mouth is an important area, and the book talks about that. It talks about the good things that you need to put in your body, the bad things you need to get out of your body that shouldn't be there. And even in the back of the book, I've got maybe 70 or so unique recipes that are basically nutrient-dense, anti-inflammatory recipes that I make basically here in my house. So I do all my cooking for the most part. My wife helps me, but I am the chief cook right now with this type of lifestyle. And I've provided some of these recipes in the book.
Beautiful. And I would assume that your family's health over the last 5, 6, 7 years has dramatically increased as well?
My family's health has increased, but I would say I'm 100%. And my wife maybe is 80 to 85% doing the things that I would think would be part of a healthy primal diet and lifestyle. But you know, it's very interesting. You can discuss with people what you think is right and wrong, but people have to self-motivate. Just with my patients, I can tell my patients the things that I think they should do, but I can't force them to do it. And I would say maybe 5% of the patients I see get on board. The far majority don't. You know, they're just not in the mindset yet. There always is a tipping point for every individual to do whatever they may want to do. Some people need to be motivated internally. For example, they have to have a stroke or a heart attack to realize, wow, I need to get my life back in order or I'm going to die. Some people think that from an external point of view, you know, my daughter just had a little girl. I want to live to see my granddaughter grow up and get married. I need to change my lifestyle so I live long enough. And then there are some people that just learn new facts, and when they realize these facts make sense to them, they make a change, and they don't have to have another external or internal story that they have to tell themselves before they get motivated. So there are a lot of people in my family and in my circle of friends who hear what I say, and some people laugh and say, you're crazy. I've been eating bread for all my life, and I'm healthy. I don't need to stop eating bread, yet they're overweight, they have high blood pressure, they have type 2 diabetes. They don't understand the relationship, but they're not motivated enough to make a change, even though I'm telling them about it.
Very well said. People have to discover their own health journey. And you know, for you, for me, this primal lifestyle just made such beautiful sense, and we've incorporated it in what we do every day in helping our patients.
Absolutely.
Thank you very much for your time. What are your final words for us?
Well, I think that if you can use this analogy, if you knew a train was coming at you, what would you do?
Get the hell out of the way.
Exactly. Now, I had no idea a train was coming at me until I had a stroke. If someone told me, and I'm the kind of person that if I feel that something is correct, I act on it 110%. If someone told me, Al, you need to change your lifestyle because the foods that you're eating are damaging your body and you could have a stroke in 10 or 20 years. Because it's not eating the bread today that's causing the stroke tomorrow. It's the cumulative effect for decades before it manifests itself. But if I understood that, I would have said to myself, self, you need to think about doing some changes here. And I would have made those changes. I think that the young people today who are so much in control of their health for the next decades, if they can understand and motivate themselves to say, what I am doing today can really harm me in so many ways 30 years from now, I need to make the change today. And what I would say is make the change as soon as you can, but the earlier the better.
Couldn't agree more. Dr. Danenberg, if people wanted to get in touch with you, you write in your blog pretty often. How can they get in touch with you?
Well, they can certainly go to my website, and that's drdanenberg.com. So DRDANENBERG.com. On my website, there is a contact form that you can send me a question or whatever through the email at the website, and I will certainly respond to anybody and everybody. I do have offices in Bluffton and Beaufort, South Carolina, but certainly my website is the most convenient place to get in touch with me.
Yes, because people from all over the country and different countries will be hearing this for sure.
Well, you know, it's interesting, and I just will make a couple comments. I have had Skype consultations with people from Australia and Switzerland. I've had a patient that came to see me who lived in England. I mean, people are looking for the right answers, and their healthcare professionals that are local to them aren't telling them what's really going on. And I think that it's not a difficult concept. It's just that it's a different concept, and you have to understand what has worked for 2.5 million years is real science. It's not what something was developed 20 years ago and maybe it worked and maybe it doesn't. If our species evolved for 2.5 million years in this capacity, that's the right way for our bodies to live.
Agree. Thank you. When your book comes out, we'll be sure to have you on again, and we'll have a nice long discussion on the book and get really down and dirty with it. I'm looking forward to that.
Thanks, Noah. I really appreciate it. It's been fun.
My name is Dr. Noah DeCoyer, your co-host, and you are listening to the Beyond Your Wildest Genes podcast. If you like what you've heard today, please share this with your friends and family and encourage them to subscribe on iTunes. You can sign up for our incredible weekly email at www.centerforepigeneticexpression.com, and please let me encourage you to check out our first project/summit at www.painreliefproject.com. Thank you, and as my oldest son Hayden says, be awesome and never unawesome.